Hello, my name is Dr. Jeffrey Rosenthal. I am a board-certified plastic surgeon with offices in Fairfield, Greenwich, and New York. Today, I'd like to welcome you to my world, the art of plastic surgery. You can see some of my art behind me, and my office is filled with some of my paintings as well as my sculptures. But today, we're going to discuss how I can sculpt, refresh, and revitalize your face and also the back of the hands. Let's talk about the aging process. Over time, sun damage causes our skin to thin. We lose elasticity in the skin, and there is pigmentary changes on the outer surface of the skin of the face, neck, and back of the hands. These can be rejuvenated with what I call an IPL, or intense pulse light, which helps to remove, soften some of the red and darker pigmented areas from sun damage. The underlying facial tissues also undergo dramatic changes with time. The skull and face have calcium loss. Females have proportionally a greater amount of calcium loss than males because they start out with less in the beginning. The other items in the face that are altered are the deeper muscle as well as the deeper fat. These thin, and because they no longer have the supportive nature, the overlying superficial fat attached to the skin now is allowed to drift. It doesn't have an anchoring point. As it drifts, it comes down the face and also along to the lip or nasolabial fold, hangs over this, causing deep folds and deep lines. And we develop a hollow or suckenness underneath the eyelid itself, such as seen in my friend over here. We can also see that there is a hollow or depression in the temple area with loss of, again, fat and muscle and exposure of the underlying contour of the skull. These deep lines over here, or grooves, are because the fat has descended and migrated to the lip or medially. And the jawline, which is clean in the beginning or when we were more youthful, now is broken with indentations. The object is to restore some of the volume by building up the cheek areas, softening the nasolabial folds, filling the region around the mouth, and restoring the lovely jawline, as well as the temple hollow. How do we do that, and what products do we use? We have a number of products that are excellent. The first one is Radius, which is a calcium-based product in a gel. This is very compatible with our calcium in our skull and in our bodies. It is injected deep along the bone in order to reshape, reform both the cheek and the arch. This lifts up the overlying tissues and resupports the skin and fat so that the hollow under the eye is much less visible. So the object is to build this area up and then mold it and sculpt it, as well as to lift up the cheek region and the temple so they're no longer hollow. As we age, we go from the normal horizontal width that is wider, which narrows down into a triangle, and that changes so that the inverted triangle now is wider at the base and narrower at the top. And so what we wish to do is take that roundness that occurs now and convert it into a more of a triangular, uplifted appearance. Radius, after it's injected along the cheek area, is then molded and sculpted. And then Voluma, at a separate seating, which is a hyaluronic acid, can be injected around it, on top of it, or underneath it in order to enhance the sculpting of your face and the contour. Voluma is a hyaluronic acid similar to what's found in our skin, and again is man-made and extremely compatible with our tissues. The lip, just like the midface, changes. The lip is not just the pink part, but is from the base of the nose all the way down to the pink portion of the lips. This sinks, and it sinks because of loss of volume of bone, muscle, and fat. We can replace this with Juvederm, which is again a hyaluronic acid injected into these areas to lift, fill, and contour. You do not want to just lift the pink portion of the lip because then it leaves you with a duck or pouting appearance, which is not very attractive. Botox is another product that is used for injection and contouring of the upper forehead. Just like the lower forehead, the muscles change with strength, the brow position is altered, and the object is to balance the muscles of the forehead and reposition the brows. I do not like to paralyze the upper face because this is unattractive. The object is to make it look pretty and relaxed. The back of the hands, just like the face, lose volume. We lose fat and our muscles thin, and the skin thins as well, resulting in the underlying vessels and tendons, which were not very visible, being very visible now. By using Radius, which was recently approved by the FDA for injection of the hand, we can contour, sculpt, and camouflage many of the vessels and tendons. I hope you've learned something from this discussion today. I look forward to seeing you in consultation, and please give us a call at 203-335-3223. Thank you.